Welcome, everyone. We'll just be a couple minutes while people start entering the virtual room. And then Wes Chapman, our presenter, will take it over.
Thanks, Ricardo. Let me know when you think we should kick off. It's a couple minutes after. I don't want people waiting around too long. Ricardo, we open. We got people
Yep,
on
we're
board.
open. We got like over
I see. Yep, people starting to show up. 32
starting to show in. Yeah, it's very exciting stuff. We've had over, almost 500 registrants. So it's a lot of material to cover. So Wes, maybe it's best if you just get started.
Sure, that's great. Okay, Ricardo, thank you very much. First, I'd like to welcome everybody to our first Medicare seminar. We're going to be doing these every Wednesday. This is Medicare 101 for Offshore Snowbirds, not snowboards, excuse me. I'm Wes Chapman. I'm founder of Fortende Health. And I really appreciate everybody being here today. This is an educational session, and it's really focused on you and what you're interested in. On the line, I have with me our maestro of IT and all things presentation, Ricardo Massi, who's been a friend and collaborator for a long time. And my wife, Martha, here is as well. And so let's get into it. The operation of the Zoom chat today, the questions and answers. If folks get tied up and have problems getting onto the audio, there's some instructions here about how to do it. Q&A button is there. If you've got some questions, submit them and we'll deal with the questions at the end. There's a chat panel as part of this, and everybody can go to the chat panel and plug in and chat with me or anybody else they want to. Ricardo is manning our end of the chat participation. We started Fortende Health, the four of us, Pepper Hatch, my wife Martha, me, and Phil Mattingly. We started the company because all of us had a tough time coming into Medicare, and it wasn't a lot of fun, and we didn't know who to trust. So we should start a company that means trust, and Fortende means trust in Swedish. This is interactive today. We want to learn too. We've got a bunch of polls here today, so please feel free to answer the questions in the polls. It will help us a lot if you do. We can serve you better the more we know about what you're interested in. Okay, first question. Ricardo, if you put the poll up, that's great. Medicare is, please select one single choice, a valuable Medicare government program for seniors, a crazy mess of incomprehensible rules and bills, a minefield where a single mistake can lead to permanent problems, or all of the above. Please take a minute, answer the poll. I don't know if, I guess I can't do it, but there are no right answers in these polls. If you get a chance, please let us know what you think. I'll tell you that from my perspective, it's probably all of the above, but let's see what people come up with. Ricardo, we're getting people coming in. And
oh, yeah. Yeah. Leave it on for a couple more seconds. We should play the Jeopardy music.
Yeah, I know it.
I'm going to end it right now and then share the results.
Okay. A valuable government program, all of the above. That's the truth. Thank you so much. You can close that out, Ricardo. A little bit about Medicare. It's a huge program. This year, it's $767 billion. It serves 62 million American seniors. It is a foundational benefit. American seniors have earned it, working their whole lives and paying into the Medicare Trust Fund. We also pay for it as we use it two ways. One through Part B premiums, through Part D participation, and through actual payments for services. Medicare is a great program, but what's really important is making it work for you, your health needs, how it works into your finances, care preferences, benefit selection, future pathways. Those are the things that matter here. Medicare, two things I want to emphasize here. One is that Medicare requires that we all make decisions every year based on program and plan changes, excuse me. You know, whether we realize it or not, Medicare plans do change every year. They're one-year contracts, and we elect to participate in them, particularly Part D and Advantage plans. So if you're in a Part D plan or an Advantage plan, the one thing you can count on is next year's going to be a little bit different. Not only will it be different, but it will be different relative to the other choices in the market. And one of the advantages to Medicare is you get to make a lot of choices. So please take some time, see what's out there, make sure that what you're doing last year is the right thing for you next year. Some key process learnings about this year, and I won't spend too much time on it. Scope of appointments are written permissions that people need to give every year. And this year, for the first time, all sales calls have to be recorded. No way around it. And a disclaimer, a sales disclaimer must be read on sales calls as well. So it's going to be a little bit different process and a little more complicated than it's been in the past. This is our agenda today. I won't spend too much time on it. I'll move right into the Medicare alphabet soup, parts A through D. Next poll. My Medicare plan is, and this is going to be helpful to us to understand what people are currently doing. I'll tell you, I can't vote in the poll because I'm the host, but Martha and I use Part A, Part B, a supplement, and Part D. And I'll tell you in the course of the presentation why we made that selection, but I'm really interested in what you're doing. So if you could take a minute, we'll play the Jeopardy music. Actually, we don't have any Jeopardy music, but take a minute, answer the poll, and I'll actually turn on my light because I sort of look like I'm sitting in a cave here. And I'll be interested in knowing how people are currently participating in Medicare. Ricardo, how are we doing in terms of?
Yep, I'm going to end the poll now and share the results.
Terrific. So some folks, about 17%, are doing Part A and Part B and nothing else. That's certainly a viable decision, but it leaves you exposed to a lot of potential cost. 23% are doing what we do with supplements. Almost half the folks, it's funny, this year about 48% of people in total participated in Medicare Advantage plans, and it looks like that's what we're doing here now. And we got some folks that aren't eligible for Medicare yet. Okay. Okay. 4 parts of Medicare, and I'll go through this quickly, but they are important. Part A, this is paid for over the course of your entire working life. You have to have 40 quarters of work to qualify for Part A for free. Otherwise, you can buy into it beginning at the age of 65. Most people qualify. And it covers hospital, nursing homes, hospice, and related facility-based charges. Part A, hospitals. Part B, doctors, medical care, tests, labs, and the like. Part A was put in place in 1965. Part B, I think in 66 or 67. And those two together are considered to be original Medicare. Part C is Medicare Advantage. And Part C includes Part A and B and frequently Part D. These are private medical plans where the government gives money. This year, I think it's around $14,500 per beneficiary two insurance carriers who offer plans that comply with Medicare requirements and can offer benefits that Part A, Part B, and Part D don't offer. And a lot of these are, you see it on TV all the time, dental, vision, hearing. One of the benefits that's important for the folks on this call is worldwide emergency care coverage. Part D, prescription drug plans. This was put in the second Bush administration. I think the legislation was passed in 2003 and it went effective in 2005. This is a maddeningly complex, but very important part of Medicare. Very important. It is administered exclusively by private companies, but it provides great coverage, particularly for catastrophic drug costs, and drug costs can get catastrophic. This should be familiar to everybody. I won't spend a lot of time on what a Medicare card is. A little bit about costs, Part A and Part B. Medicare was designed originally to cover 80% of Medicare-approved healthcare costs. Over time, it's developed into Part B as a defined fee schedule, and Medicare pays 80%. You're responsible for 20%. Part A has a complex series of deductibles, which we'll go through in a minute, and some copays. Other costs, this year, the Part A deductible, the year coming, is $1,600. The Part B deductible is $226, not a big deal. Part D premium, estimated to be around $30 a month. Part B coinsurance is 20%. And this can really add up in today's environment. And it's one of the reasons that I'll get into pathways a little later on, but I want to make sure that people understand that they can get on a pathway which is economical to them and covers Part B coinsurance, because that can be ruinous. Part D deductibles and copays. It's a maddeningly complex system that I'll touch on today. The coverage gap, which I'll touch on, is part of it. One good piece of news for folks on the call who are experienced with Medicare: last year, the Part B premium per month was $170.10 a month. This year, it's going down, $164.90. It's not going down a lot, but every little bit helps. Your options. Questions to consider when you're choosing Medicare options. These are pretty obvious, but I'll spend a moment on them. Premium, what can you afford? And one of the good pieces of news about Medicare Advantage plans today typically is many of them do not have any premium associated with them. Services, does the plan cover the services I need? This is particularly important for Advantage plans. Doctors, can I see the doctors I want? And this is critical for Advantage plans. Advantage plans all operate on managed care networks, and making sure that you get to see the doctors you want is a critical issue. It's something we spend a lot of time on, trying to understand what your physician requirements are. Travel. Will my coverage travel with me? And this is a critically important issue for Snowbirds. Do I get coverage when I'm outside the United States? How does it work? How long does it work? And there are two types of coverage associated with Medicare. You can get, and we'll go through it more later in the presentation, but both supplements, original Medicare, and Advantage plans can provide pathways to coverage for you outside the United States. The two pathways that you can choose from, as I mentioned, are Medicare Advantage. It's also known as Part C, MA, MAPD. It always combines Part A and Part B. Most include Part D. Medicare supplements plus a drug plan include your Part A and B. Drug plan is separate if you buy it. And one of the things I recommend to everybody, if they don't have a drug plan, think about it carefully. Drug plans and Part B have substantial penalties for not participating. They cost money to participate, but if you don't participate, there are penalties if you join later. Supplemental insurance is important. You can buy it. It's typically done on a state-by-state basis. We'll get into that in a minute. Ricardo, if you could, couple of important questions for Medicare Lunch and Learn about time spent outside the United States. You got that next poll? Here we are. And I'll go through why this matters as you're filling it in. 4 of the 8 or 10 functional supplement plans provide coverage for foreign travel for trips up to 60 consecutive days outside the United States. It's 80% of incurred costs up to a lifetime cap of $50,000. Those are the rules imposed by the government. They're the same for all of the same supplement plan types. If you regularly spend more than 60 days outside, supplements aren't going to work. The good news is that many Medicare Advantage plans today offer emergent and urgent care outside the United States, which in many cases has a simple co-payments requirement, which is typically reasonable. And they typically provide for travel outside your home market for periods of either 6 months or a year, depending on the, and here we have it. So most folks spend more than 60 days outside the US, some don't. 29% of the folks have a permanent address in the United States. 16% of the folks have told the United States that they're living permanently outside the US. And I'll get to each of these and what they mean. If you spend more than 60 days outside, then an Advantage plan is really what you need. Having a permanent residence, permanent address in the United States, if you have it, it will allow you to, and the rules here are pretty special. I'm going to do another presentation next week about residence and what it means. And it's important for all snowbirds to understand what residence means in a Social Security, the administrative group for Medicare. For group number 4, if you've told the US that you're permanently living outside the United States and you maintain Part A and Part B, interestingly, you are exempt from Part D penalties while you're living outside the United States. So I've had people in the last year who were living outside the United States, had told the US they were living outside the United States, had Part A and B, moved back into the country, and enrolled in a Medicare Advantage plan. If you have an emergent situation outside the United States, come back to the United States for care, you will have original Medicare, Parts A and B, assuming that you've maintained it while you've been gone. Part A is easy, Part B is a little more expensive. And when you come back, you can be enrolled in a Medicare. You have a special election period. I'll get into what that means. But it means that you can get coverage for comprehensive coverage under an Advantage plan between 1 and 30 days after you come home, depending upon what day of the month you come back. Enrollment's the first day of the subsequent month. Medicare Advantage. Another Medicare Advantage plan is best thought of as comprehensive coverage and a way to get your Medicare Part A and B. Talked about being called Part C, frequently includes D, and also frequently includes other benefits. What does it cover? Covers your deductible, covers your annual deductible for Part B. It will cover co-insurance for doctor services and often includes Part D. It will include other benefits not covered by original Medicare. Those can include vision, dental, hearing, acupuncture, meals, travel, and emergent care outside your home market and outside the United States of America. If you choose Medicare Advantage, there are two ways to play it, either a HMO or a PPO. Next question, Ricardo, if you could put up the poll about provider choice. This is important in terms of if you are going to participate in a Medicare Advantage plan, how important is provider choice to you? Very important, not important. And do you understand the difference between an HMO and a PPO? I encourage people normally, if they can get a good PPO with if you can get a good PPO, which means that you can choose doctors outside the network for an increased cost. HMOs are typically limited within the realm of the network. So for folks, and it's most of the people on the call who want to have provider choice, PPOs are typically a good solution. Thanks, Ricardo. Okay. HMOs, you use doctors in the network. You will need a referral to see a specialist typically. PPOs, you can use doctors and hospitals outside the network, but often with a higher copay. Typically, HMOs and PPOs have differences for in-network, out-of-network, maximum out-of-pocket cost for the year. And that's an important consideration for everybody, is what's the maximum out-of-pocket cost that you can be charged. There are federal limitations on it. I will say most HMOs and PPO plans this year have limits which are considerably below the federal max. But again, it depends on what's available in your area. Pros and cons. Typically, there's little to no monthly premium now with Medicare Advantage plans. They typically include prescription drug coverage. They have additional benefits shown here, and including, in many cases, I think over 60% of the plans this year include worldwide emergent and urgent care benefits. And they've got a maximum out of pocket, which is great. Cons that there are network restrictions. Costs aren't standardized like Medicare supplements, so each plan's a little different. One will charge a certain amount to see a primary care. Typically that's $0, but specialists will have different amounts. The days you spend in the hospital will have different amounts of copays, different amounts of deductibles. It's very complicated. And the benefits change every year. So if you have an Advantage plan, please, whether it's with us or somebody else, take some time, look at what's available, what your plan has for next year, and what else is available in the market. Make sure that what you're doing is right. Medicare Lunch and Learn. If you could put up the next poll here, Ricardo, I'd appreciate it. There we go. Okay. Do folks understand the basics of Medicare Advantage plans or not? Or you understand the basics but have a lot of questions? And I must tell you the truth. I fall into group 3. I understand the basics pretty well, but I get questions all day long, and I basically spend my life answering those questions because there are so many answers. These plans are so complicated and they have so many different ways that they can go. If you don't have a lot of questions about your Advantage plan, you may not be looking. Okay, people feel pretty good about them. Some don't understand, and I hope this helps. This presentation helps. And if you understand but have a lot of questions, I'm with you. Okay, supplements. I won't spend too much time on supplements. There aren't that many people on this webinar that are on supplements. But for people who are, we like supplements. Martha and I are on supplements. The reason we do it is because we don't travel outside the United States for more than 60 consecutive days. I really want to have the emergency care coverage outside the United States. We had a dear friend who was on a Rhine River cruise and broke his hip. It was very unfortunate. Didn't have the right coverage and also didn't have Medevac insurance, but that's a separate question. We like them because they give us infinite provider choice within doctors who take Medicare. And we can do it any place we want in the United States. I spend a lot of time skiing. I have bad knees. Once in a while when I'm skiing, I need an injection in the knee. I can go to any doc that'll do it, which is great. Supplements cover the gaps. They're also called Medigap policies. They cover co-insurance, co-pays, and deductibles. Original Medicare is, for me, not a good choice unless you have both a supplement and a Part D plan. It's entirely up to you, but that is what we do, and that's what we recommend for all of our friends and clients. Medicare supplements are standardized. They're standardized as to benefit, but not as to price. So when you go shopping for a supplement, a N plan may be different price by as much as 150 or 200%, depending on the carrier. Price is a very important criteria, but so is the size of the carrier and their history of stable rates. One of the things that I'm very interested in for our customers is that they be in plans that offer stable rates, because it's really, really important. Medicare supplement plan choices. This is just a typical slide. You can see that plans G, N, and F. F is only for people who are eligible for Medicare before 1/1/20. We have Gs because we were not. They do provide coverage outside the United States, but only for trips up to 60 days and for amounts lifetime up to $50,000. Medicare supplement, you have a 6-month period when you turn 65 to get one on a guaranteed issue basis. After that, they're underwritten. The underwriting process is complicated. It depends carrier to carrier. The decision process depends carrier to carrier, and candidly, state by state. It's complicated and beyond the scope of this presentation. If folks are interested, let us know. We'll do a presentation on supplements. The benefits are standardized. There are no network restrictions. If choice is important, supplements are important for you. And we had a customer last year who basically spent most of his time in Snowbird status outside the United States, came back occasionally, off and on throughout the year. And he wanted a supplement. I said, geez, it's not going to provide emergency care outside the United States. He goes, I don't care. What I'm interested in is having a supplement because I have special medical needs and I want to be able to choose the doctor I want in the United States. That's what I'm interested in. And that's why I want a supplement. For him, it made all the sense in the world. There are high deductible G plans, which for 40 or 50 bucks per month you can get, and you can go to any carrier you want in the United States. Cons are that the monthly premiums typically go up annually. Prescription drugs aren't included. You're going to need a Part D plan or subsequently pay a premium if you come into the program. And it doesn't provide additional benefits as an Advantage plan may do. Ricardo, if you would, the next Lunch and Learn poll here, I'd be interested in how folks think about supplements. Oh, and Martha just said, make sure people understand that OUS is outside the United States. Why would any snowbird outside the United States ever care about supplements? And I hope I answered that. But if choice is really important to you, then getting a supplement is what you should do. How are we doing, Ricardo? Okay. Folks seem to understand them. Some folks don't understand them. If you think it'd be helpful on one of these Wednesday lunch and learns, we can do a supplement presentation. It's an interesting part of the Medicare program. And I hope I answered this one. Why would they ever be interested? Okay, thanks, Ricardo. Okay, prescription drugs. I'm not going to spend too much time on prescription drug plans because I think most people on the presentation are on Advantage plans. Advantage plans typically cover Part D. Three things that you might wonder about is, are my drugs covered? What will my out-of-pocket costs be? And can I use the pharmacies that I want? Medicare Part D is a formulary-based program. Medicare specifies drugs that in each class that must be covered. Every Part D plan must have drugs in each of the classes. Formularies can change monthly. They publish a drug list. These are four-dimensional matrices in terms of determining cost and coverage. The drugs are on a tiered list up to 7 tiers, which drugs may be on or off those each of those tiers. The pharmacies may be in or out of network. This for standalone versus MAPD, you can buy a standalone drug plan. That's what we have. Some of them are very inexpensive, and you can get them through your Advantage plan, and typically at no additional charge. This was the third part of the matrix. Depends how much you've spent. There's a deductible, sometimes not. There's an initial coverage period. There's a coverage gap, which was previously called the donut hole, and then catastrophic coverage above that. This is true for all drug plans, and it's true this year. Next year, we're not sure. Congress passed a cap of $2,000 maximum out of pocket. So what plans will look like next year, excuse me, I'm not sure, but this is what they look like now. Again, Ricardo, if you could put up the Part D drug plan coverage, I'd appreciate it. Poll. Okay, I understand the basics of Part D drug plans. I don't understand the basics, and how could anyone ever understand this? These Part D drug plans sort of remind me, understanding them. I took a calculus course in college that include partial differential equations. I could never understand them, and I kind of feel the same way about Part D drug plans, but I've tried in both cases. How are we doing, Ricardo, in terms of, okay, people seem to feel they understand the basics. That's great. I won't spend much more time on them. Thanks, Ricardo. Enrollment and eligibility. Again, most folks on the call are in Medicare. I won't spend too much time on this then. Everybody at the age of 65 has a 7-month window, 3 months before your birthday month, and 3 months after to enroll in parts A and B. There are all sorts of, if you continue to have creditable coverage, you don't have to enroll in Part B and you won't suffer a penalty, but you have a special election period subsequently to make that filing. Annual enrollment period. This is what we're going into now. You can start talking about plans, and I'm sure you've seen the ads on TV, beginning October 1st. Beginning October 15th, which is this Saturday, people can enroll for plans for next year. And that goes on through December 7th. I encourage everybody, whether you change plans or not, and whether you do it with me or not, please, please, please take a minute, look at your plan, figure out what you've got, and make sure it's what you want. You can switch anything you want during annual enrollment. And then there's an open enrollment period subsequently, which goes from January 1st through March 31st, where if you think you made a mistake, you can change without penalty. Special election period, special enrollment periods. There are millions of these, and they are announced frequently. Every time there's a fire or flood, it seems to be a special enrollment period for those poor folks. They also include losing your employer coverage, moving to a new service area, if you get extra help, if you qualify for certain chronic conditions, if you move into a care institution. There are a lot of different reasons for special enrollment periods. It's its own science. Ricardo, if you could, the next Medicare enrollment basics poll. I understand the basics, and I do. I don't understand the basics. No, I do. Medicare enrollment, it is complicated because there are special enrollment periods for Advantage plans. There are special enrollment periods for drug plans. There are rules which are special for supplements. There are statewide rules which impact both. And there are special rules and penalties associated with Part B and Part D. Okay, great. Folks are comfortable with it. Let's move on. Enrollment requirements. One of the things that I encourage folks to do, our website is designed to help folks understand Medicare. It's called Insights, it's a blog. It's blogs that I've written about different things that people have told me they're interested and they want to learn more about. If you want us to help you look at your Medicare for this year, we're delighted to do it. Please look at the client enrollment form section. This is a HIPAA compliant form that we put up this year. It's secure. It's the minimum. My information's in it. Martha's information's in it. All of our customers' information are in it. And it's the way that we can evaluate your needs and then get back to you. I'll get back to you after we get a scope of appointment form and have a review meeting to see if it makes sense to do something different or not. It's all online. Feel free, use it, don't. But we really appreciate it when our customers have filled in the Medicare questionnaire, because it makes it easy for both of us to actually give you the best service that we can offer. Q&A, Ricardo, you might want to come live and see what kind of questions you've got. I've got some here.
Lots of questions. Thank you, Wes. Great presentation. I'll just try to sound off on these questions as they came in and answer as many as we can. And I know that we have a lot that came in prior to the webinar that I think you guys printed out over there. But let's start with the first question from Margot. She says, I live in San Miguel de Allende, Mexico. Does your company offer coverage in my area? I know there is Medicare Advantage coverage in other parts of Mexico, but as of July, there were no providers in my area.
Okay, that's an excellent question and gets at a fundamental misconception about Medicare Advantage. There's been a lot of talk in Mexico about accepting or not accepting Medicare Advantage. It's important that folks understand that no Medicare, with the exception of a couple of physicians in a few towns in Canada, can actually be paid by Medicare. And that Medicare Advantage plans are between you, the beneficiary, and the company. Now, they will provide coverage for emergent and urgent care. And it's important to understand that the inclusion of urgent care was a big step. Because as an example, if you go to the doctor and you've got pains in your stomach, you think it may be appendicitis, it may be appendicitis, or it may be a stomach bug. If it turns out to be a stomach bug, it was an urgent care visit. If it turns out to be appendicitis, it was an urgent care visit. Excuse me, emergent care visit. So by covering both, it's really expanded the coverage for folks outside the United States, which is great. You can go to any hospital that you want to get urgent or emergent care if you have a policy that provides for it. You will be required to pay that hospital, and the carrier will pay you back. I encourage folks, and it's typically required in the policies, that if you have an emergency outside the United States and you go to the hospital, please call up your insurance company and tell them that you've had an emergency and that you're going to be submitting a claim. Please, if you have given your credit card, and typically you have to, call your credit card provider and let them know that you don't want any charges made against that credit card unless you orally, verbally approve it. And give me a call because I can help.
Yep.
But there is no one outside the United States who can legally accept Medicare Advantage plan. So feel free in San Miguel de Allende to go to any hospital you want if you get sick and have an emergency.
Yep. Next question is from Dave. Is Medicare available in the country of Panama for U.S. citizens? Where do I go?
Medicare is available for U.S. citizens who have a permanent residence address in the United States. Residence address we'll get into next week doesn't mean four walls and a roof. It means a place where you actually go frequently and maintain such things as medical care, which I hope you're doing because that's what this is about, banking, driver's license, etc.
Great. The next one is,
go ahead.
Based on my residence in the U.S., I am told an Advantage plan is not available. I have Part A and B. I also have health plan through my retirement, which covers worldwide coverage. I spend a lot of time outside the U.S. Should I have any of these supplements?
Ooh. Read that again slowly, would you?
Based on my residence in the U.S., I am told an Advantage plan is not available. I have Part A and B. I also have a health plan through my retirement, which covers worldwide coverage. I spend a lot of time outside the United States. Should I have any of these supplements? Okay.
That's a little bit of a mixed metaphor there because I think what they're really asking about is Advantage plans. It's not clear to me if they have a plan through their retirement. It probably is an Advantage plan. And they're probably not eligible for a second because they have one. But please give me a call. Let's get straightened out and make sure that I can help.
Sure. Okay, now let's go through the chat. A lot of people saying hello from different areas. La Paz, Mexico, Baja, Cabo. Great to have you guys here. Okay, this one is from Jay. How can I get my wife, 65 years old, Medicare from Cabo San Lucas without going to the US? We have tried online and it is not working.
Give me a call. I think we can be helpful.
Okay, great. The next question is from Harlan. I live outside the US permanently. What is available for me?
Harlan, it depends if you have a permanent address in the United States or not. For a lot of folks, they make a decision that, as an example, they have a residence with their children. They go back and see them frequently. A lot of it is based on where they want to go if they subsequently need care in the United States. You know, you're paying for Part B. You want to take advantage of it. Having an Advantage plan covers those needs when you go back. Again, it's one of those things. We're going to have a talk about residence requirements next week. But give me a call, drop me a line. Understanding it, you know, I need to understand better what the circumstances are. This is a facts and circumstances driven answer.
Sure. Yeah. Very different nuances. Okay. Robin has asked, oh, excuse me. Luella is asking, I return to the United States 1 to 2 times a year and see my PMD or referral docs test then. Otherwise, it is cheaper to pay out of pocket for anything else. It's more of a comment that was like adding to the conversation of what you were saying.
Yeah, it's absolutely true. I think that, you know, we're working to see if we can come up with a plan first for Mexico in the next couple of years, which would be our primary care plan. I think that that's an important thing that people should have available and something we'd like to make available for, you know, our customers. We don't have it yet right now. People have to kind of find their own way, but medical services of a primary care nature are really quite inexpensive in Mexico anyway.
Sure. Yep. And the questions keep them coming, folks. Robin is asking, what is the cost to get help with Medicare enrollment?
Once again, slowly, please.
What are the costs to get help with Medicare enrollment?
Oh, it doesn't cost anything. The carriers pay us. You know, when Martha and I came in, we had paid for a consultant who we felt a little bit railroaded. We don't charge a fee. We're paid by the carriers. We do get paid for enrollments, but it doesn't cost anything to call me up. We never charge our customers anything.
Yep, and I'm putting the links to book time with on your calendar on the chat, guys. It is free to book a call or a Zoom call with Wes and the team. They're here to help you. So those links.
Please feel free. We're here. That's what we did this to help people. We wanted folks to.
Seniors helping seniors.
Yeah.
Okay, the next question from from Bill is, can you please talk a little bit more about eligibility requirements?
Sure. There's eligibility begins at 65. There are certain people that are eligible before 65 if they are disabled. Once they're disabled for 25 months, they're eligible for Medicare coverage. Once you're 65, assuming that you have Part A, which means that you have worked 40 quarters and had a W-2, which is 10 years, you or your spouse has, or 1099, as long as you paid Social Security, you're eligible for Medicare. If you have additional questions, if you've had problems getting in, if you need some work with special enrollment periods, let me know. Special enrollment periods are wildly complicated. I spend a lot of time helping people work their way through them. And they're very important to get the coverage that you need.
Right.
As an example, working with a person last year outside the United States, told the government that she was living outside the United States, moved back to the United States. When you move back to the United States in that circumstance, you have a special enrollment period. You've moved. If you move your residence in the United States, you may have a residence with one of your children and you move to a different one. That residency move is a special enrollment period. There's a special enrollment period if you want to participate in a 5-star plan. We live in Nashville, Tennessee. Great town, good music, great food, and more 5-star plans than you could shake a stick at. 5-star plans have a permanent special enrollment period. So if you don't like what you got in the middle of August, you can switch to a 5-star plan, no questions asked.
Great. Great, good question. Robin, once again, what happens when you have a residence in the US but gain residency in another country? For example, Costa Rica.
You know, it's important to remember that these are completely separate issues. The United States government doesn't care about anything in terms of your residence outside the United States. They're only concerned about your residence inside the United States. And if your residence inside the United States meets the residency requirements, which Social Security puts down in black and white, we can help you with. It doesn't matter if you have permanent residency outside the United States. Many of our customers have permanent residence in the United States and outside the United States. I know it's a little bit of an oxymoron, but it seems to work.
Yeah. So the next question is from Sharon. We live in Costa Rica most of the year. We will well over 60 days at a time. We are using Plan G, but now I think maybe that is a mistake. What do you think?
You know, we have Plan G. I love Plan G. It's great. But if you're out for more than 60 days, you're really not going to be covered. And I was talking to one person earlier this year. I actually enrolled them in a plan who was out for more than 60 days, had an accident, applied, and was denied because they did not, and it was an accident, it was a motor vehicle accident, because they've been out for more than 60 days. You know, if you've got everything else, please consider an Advantage plan. Many Advantage plans today do have excellent worldwide coverage.
And this next question actually refers to, is actually very relevant to what you just said. Elisa, she says, I broke my hip while visiting my daughter in San Miguel de Allende. I was in emergency care in 2 hospitals.
Oof.
I paid with my credit card and applied for payment to Medicare. I did not receive a single penny from Medicare.
Right.
Depends on their plan.
Depends on your plan. You know, Medicare, as an example, if you have Part A and B, Medicare has no capability of making that payment. If you have A and B and a supplement, and it's a Plan G, and you're there for less than 60 days, just Plan G, there are other plans, N has it as well. D and G, I think. M. Anyway, senior moment. They will pay, but Medicare itself won't pay. If you had an Advantage plan and it had worldwide coverage and you were down there for a visit, would absolutely pay. It would have paid. So I need to know the facts and circumstances, but that is a good example of why you should consider some of these alternatives for emergency care.
Yep. Scarlett, I have temp residency in Mexico and have Advantage. Is that the best policy?
I'd need to look at the policy. You know, it depends on a policy by policy basis. You have an Advantage plan. I don't know if it has worldwide coverage. That would be the first question. You know, how many months are you in and out of the market? If it's more than 6 months, maybe, you know, it's a different plan you ought to consider. But in general, I think based on the plans available today, the most popular plans, you know, I was talking to somebody from one of the major carriers, and they said, look, we switched everything. We have worldwide coverage on all our plans. Why not? It's an interesting perspective. Give me a call. We take a look, make sure that's the right thing for you. That's all.
Sure. Martha, I believe you guys have those questions from that were emailed in.
Yeah.
I know we have like 4 minutes left.
Okay.
You're welcome, Scarlett.
Okay. If it says, if I'm on a supplement and switch to an MA plan during AEP, can I switch back without health questions? The answer to that is within the first year, yes. And it's one of the things I encourage everybody. When I switch somebody out of a supplement, I always tell them, if they don't like it, if it doesn't work for you, please tell me. You have a special election period to go back to the plan you had before, no questions asked. It's a one-time benefit over the course of your life. You can't keep doing it year after year. But If you make that election, you can go back. Another question here. My friends have told me not to get a Medicare Advantage plan. Why would they say that? You know, last year, and I do the research on this, and I put it in a couple of the blogs that I've written. Satisfaction with Medicare Advantage plans went up 3%, but complaints about marketing went up double. I think that the plans are actually getting better and better. They're getting broader and broader in terms of coverage. People have had bad experiences in the past in terms of not getting coverage, not having access to care. I've had people actually had to switch out family members and partners who were unsatisfied with the plan they were in. One of the things that you need to understand is that open enrollment period exists for a reason. If you end up in the wrong plan, okay, make the change. Don't hang around a plan you're not happy with. One of the questions I have here is, what if I don't take any prescriptions? Bravissimo, I don't either. I have a drug plan. It costs $7 a month. And I have it for two reasons. One is for catastrophic coverage. God forbid I get cancer and I need one of those orals that cost $20,000 a month. I've got protection. The second is I don't want the penalty. The penalty for not participating is $3 a year. You know, it adds up. I'm paying $7 a year to have full protection. I just assume do it.
Hey, Wes, there's a question I missed from Elaine. Thank you, Elaine, and everyone. My husband has a supplement plan G. If he cancels this month, would they cover his medical emergency outside the country if he had the plan while the emergency happened last year in December 2021?
No. I think that if the medical emergency happened last year in December, I think it depends on the plan. I'd need to look. That's one of those things, facts and circumstances, give me a call. You know, there are periods where you have to make filings. That filing, if you didn't make the filing last year or within the first quarter, it's going to be more difficult, but it's worth taking a hard look at. You were covered at the time it happened. And so cancellation of the plan should not change the fact that the money was owed. The problem in this case isn't that the money was owed, it's that the claim wasn't filed.
Yeah. Wes, I know we could go on and on with all these amazing questions submitted. We're at 2:00. If you want to put the next slide and a reminder, folks, next week we're having another Lunch and Learn webinar at the same time. And this one's going to be focused on residency, Medicare residency requirements. We're going to be sending all of you the follow-up with the recording of this presentation and a link so you guys can register for the next week's Lunch and Learn webinar. Again, if you need to contact Wes directly to discuss your options, you can book time in his calendar. The link is in the chat. Or you could also just, if you're ready to like really get more in depth, you can also fill out the intake form. I have those links. I'm going to paste them again. It's so important that you guys get in touch with us. You know, Wes and the team, they're here to help. And you know, that's the goal for Fortende, is just to make sure you guys get the information you guys need so you can make the best decision.
Yeah, I mean, this is one of these great retirement jobs. I can make a little money, but I can really help people. So let us help.
Tell your friends.
Elaine said that yes, that she did get the bill this month, FYI.
Okay.
But again, please reach out to us. You guys, the link's in the chat. We're going to keep it open. Thank you so much for joining. And we'll send you all out the link with the recording of this presentation. And of course, we're going to add email you guys the registration to next week's webinar, which is on residency. So each week, we're going to be adding different topics and different focus on these webinars that Wes is preparing.
Thanks, everybody. I really appreciate your time. I hope you found it valuable. I did. I learned a lot. Thank you so much for those polls. And I look forward to talking next week about a little bit about residency. Thank you, and we'll talk soon. Bye-bye.
Thank you, Wes. We'll keep it open a couple. Elaine, you're welcome very much. Thank you for such great questions, everybody. All right, folks, now I'm really going to shut it down. Thanks again for attending. See you all next week. Bye-bye.